Okay, let's discuss about Raynaud syndrome today. So, Raynaud's phenomenon, it's an episodic pallor of fingers and toes. As you can see in this image, there is pallor of the fingers. And why does this happen? This occurs due to vasoconstriction of the small vessels. The small vessels in the fingers and toes undergo vasoconstriction in response to cold or emotional stress. Okay, as mentioned, it is an episodic phenomenon. It does not occur all the time, but in response to cold and emotional stress, this phenomenon occurs, and it has three phases. Okay, let's discuss the three phases. See, this is the normal artery, normal vein, and what is this? This is the capillaries, right? Artery, vein, and capillaries, right? What happens in response to cold? In response to cold, there is vasoconstriction. So what happens here? This is the normal image, normal artery, vein, and capillaries. You can see here what happened here. Both the arteries and veins both went into vasospasm. You can identify the difference between this artery and this artery. Can you? Right. Uh, Both the artery and veins, they go into vasospasm. So what happens here? Because of both artery and vein in the vasospasm, the blood flow to the capillaries will be decreased, right? So this is how the hand will appear. There will be pallor. There will not be any blood flow in the capillaries because of the spasm of both artery and vein, and there is pallor of the hands. This is the phase 1. Okay, this is about phase 1 of Raynaud's phenomenon. Next, let's discuss about phase 2. Okay, what happens here is the vein, it's still in vasospasm. You can see the normal vein here. You see the vein here. What happens here? The vein is still in the vasospasm, but the artery is relaxed. Okay, because of this, there is mixture of oxygenated and deoxygenated blood. So the hand appears like this. What is this? It's a blue and painful hand. It occurs due to the mixture of oxygenated and deoxygenated blood. Okay, this is phase 2. Phase 1 is pallor. Phase 2 is blue and painful hands, right? Next, let's discuss about phase 3. So what happened in phase 3? Can you identify the difference between these two images? Wait, let me just erase this. One second. Okay, this is phase 3. What happens here? You can see both the arteries and vein, they are back to normal. Both arteries and vein are relaxed. So the hand appears normal again. Okay, the three phases are: phase 1, the skin turns white because the blood flow is restricted. As mentioned here, you see both the artery and vein are in vasoconstriction. Therefore, there will be pallor. This is phase 1, right? Next, phase 2. The skin turns blue as blood vessels react. So what happened here? The vein is still in vasospasm and artery is relaxed. This leads to blue and painful hand. You can see here because of the mixture of oxygenated and deoxygenated blood. Okay, phase 1, phase 2, and phase 3. Phase 3 is normal. There is relax. Okay, both artery and veins relax and skin turns red. Okay. This is about Raynaud's phenomenon. So regarding the management, we use calcium channel blockers in the management of Raynaud's phenomenon, and also there are certain diseases associated with Raynaud's phenomenon, like this rheumatological and connective tissue disorders, which you learn soon. Okay, thank you.